I guarantee that you have multiple adult clients right now with undiagnosed ADHD. In this video, you will learn how to spot these high-functioning clients. Specifically, I will discuss 3 signs that should raise your suspicion that the client in front of you has inattentive ADHD. I'm an Oxford University researcher turned psychologist and entrepreneur. I currently work as a senior psychologist specializing in neurodiversity assessments, and I'm also an author of the Psychology Today blog on this topic called Divergent Minds. So the first sign of inattentive ADHD in high-functioning adults is in the domain of organization and appointments. So is the client in front of you often running late for appointments, or do they consistently miss appointments? Do they set alarms galore? So they have 100 different alarms or reminders on their phone or on their laptop to keep them on track. Do they struggle to organize family life when kids enter the picture? All of these things can be, when consistently demonstrated, evidence of inattentive ADHD. The second potential sign of inattentive ADHD in adult clients is consistently failing to finish complex or boring tasks. So does your client have unfinished projects galore? So lots of unfinished projects. Do they lose interest midway projects due to not being able to break them into multiple steps, or just simply losing their interest? Do they need external pressure to finish tasks? All of these, when consistently exhibited, can be signs of inattentive ADHD again. And a third sign of potential inattentive ADHD is consistent difficulties in starting boring or complex tasks. If interested in a task, people with inattentive ADHD can often start those tasks really well and often finish them really well. But if they're not interesting tasks, if they're not interesting to the person, they very strongly feel that these tasks are extremely boring or extremely unpleasant. And people with inattentive ADHD also can get easily overwhelmed by outstanding tasks and struggle to break them down in subtasks or sub-goals. Importantly, if you observe any of these signs in a client, ask them whether you can administer the Adult ADHD Self-Report Scale screener or the ASRS screener. This is a 6-question screener specifically designed for adults with potential ADHD, and it gives you an indication as to whether you want to further look into an ADHD assessment potentially or not. If you want to learn more about ADHD assessment, check out my video 5 Steps to Delivering Client-Centered Neurodiversity Assessments on YouTube.